Hey everyone, I think we're live. This is Dr. David from El Paso Manual Physical Therapy. Just clicking all my buttons on my software here. We're going to be talking about the 10 best advice tips for healing a meniscus tear so that you can avoid a surgery. Just in case you're tuning in, I got somebody saying no sound. Why? Can you guys let me know if you can hear me? Just type in the chat if you can hear me at all. Give me a thumbs up or say I can hear you. And if you can, let me know where you're at. Where in the world are you so that we can check in. Miss Kimberly's here. Hey, Kimberly, can you hear me, Kimberly? Great. She says I can hear you. Fantastic. My audio is working. All right. Very cool. Well, let's just let a few more people get on, and then we're going to start talking about our list of 10 meniscus tear tips to heal and avoid surgery. Ordette is here from Orlando. Thanks for letting me know you can hear me, Ordette. We got a few more people chiming in. Dwight is in Southern California. Thanks, Dwight. I appreciate it. My spirit, soul, and body is in South Africa. Thank you for letting me know that you can hear me. Fantastic. Grand Rapids, Michigan's here. Ohio's here. Hey, Lori. We got Felisa in San Antonio, a fellow Texan. Fantastic. Hi, Felisa. Bienvenidos, if you speak Spanish. Linda is in Alberta, Canada. Hey, Linda. Thanks for joining us. We'll get a few more in, and then we're going to start about talking about meniscus tears here. Marianne is in South Carolina. And then we have Egil in Estonia. Eagle. Oh, I love your work. Thank you. I appreciate it. We're trying to help everybody out, trying to give you what you need so that you can heal without surgery and get to feeling fantastic again. I appreciate it, Eagle. And then we have Dora in Las Cruces, New Mexico. That's like just down the road, not even an hour away from us in El Paso, Texas. Hi, Dora. And you're from Southern Italy. Fantastic. We got Connie from Delaware. Wisconsin's here. London's in the house. Sheila says she can hear us. Connecticut. Fantastic. Hey, thank you guys all for checking. I'm gonna take a break from that so we can get to it here. I appreciate you guys joining me here live. Thank you so much. Ask questions in the chat. I can see your comments from YouTube and from Facebook. We're live on Instagram as well, but I can't see your comments, and I'll get to them. Let's get into this topic here. Meniscus tears are a problem. And just to make sure we're all on the same page, here's a knee joint. This is the thigh bone at the top. Here's the shin bone at the bottom. And you have this little bone on the side called the fibula. I'm not going to talk about that one today. So thigh bone, shin bone, and then you have the kneecap right there. And just between the thigh bone and the shin bone, you have this thing right here. That is your meniscus. You have a pair in each knee. So plural is menisci. One would be a meniscus. And there are these C-shaped structures, kind of hard to see, but you can kind of see it right there. I'll give you a better camera angle. And they're connected to each other, to the bones, to some muscles and ligaments in the area. They kind of touch a lot of things, but their main job is to create a cushion between the thigh bone and the shin bone so that you can absorb forces and be able to walk, be able to be active, be on your feet, do things. And so what they're doing is also controlling the motion between the thigh bone and the shin bone, because as you can see, the end of the thigh bone here is rounded. And so the top of the shin bone is kind of hard to see here, but it's more flat. It's got some curves in it, but it's more flat than anything else. And so putting this rounded surface on a flat surface kind of doesn't make a lot of sense, but that meniscus has a cup shape. It's what we call concave. So the femur is convex, it's round, and the meniscus is concave. So it kind of sits in and creates what we call congruity. It's like it fits well, and it allows your knee to move well while allowing a little bit of flexibility. There's a little bit of rotation. There's tiny bits of sideways motions. There's all these little tiny motions you could do. And it's in these motions that you begin to wear down or tear the meniscus. Meniscus tears usually happen in people that are in their 30s. It can happen in their 20s, but 30s and 40s is when you tend to see it. And then eventually, if the problem persists, you end up developing osteoarthritis in your knee joints. So it's a big deal. If you can avoid a surgery and if you can avoid worsening a meniscus tear, when you're in your younger years, in your 30s and 40s, definitely in your 20s, so that you don't get knee arthritis later on, because then you might be set up for a knee replacement. And there's even surgeries that people do for meniscus. The surgeons can do for a meniscus tear. And, they're coming into question right now because there's a lot of research showing that maybe you can get away without having a surgery if you do the right things. But that's the magic question that I'm here to help you with, is what are the magic things? So I got 10 of them for you. Let's dive into it. Let me get my list out. Let's get some colorful markers for you guys. So number one thing, huge deal, is offloading. This means that you take pressure off your meniscus, off your knee, by using crutches, a walker, or a cane. So, crutches, like you're crutching around, if you can get the weight off your knee, immediately you're going to get relief from the pain in your meniscus, and you're going to allow the meniscus to begin to go through a healing process. But if you have a meniscus tear, if you know you have a meniscus tear, you've had the MRI, it's been diagnosed, and you're not on crutches and it's hurting you right now, like, that's a key factor. Let me just distinguish that. If you stand on your leg, on your knee that hurts, that you have a meniscus tear in, and you immediately feel pain, you're not even doing anything, you're just standing on it. If you just shift your weight over to it and pain creeps up, that you feel the pain come on, that is a clear sign that your meniscus gets worse when you put weight on it, obviously. So it makes sense then to get on some crutches or put your weight through a cane so that you can still get around and walk and do things, but you're not aggravating that meniscus, because each time you get an increase in pain by bearing weight through it, you're just aggravating it a little bit more. And over, thousands of steps throughout the day, you're just irritating your meniscus. Don't want to be doing that. So key first thing to do, if you have an aggravated meniscus, and just to differentiate, the other option would be you have a history of a meniscus tear, but it's healing, or maybe it's healed, and so you have a history of a meniscus tear, then there's different stuff to do. I'm going to tell you more about that in the rest of the numbers, but this specifically is for if your meniscus is aggravated right now, you need to be making sure to offload it. Can't stress that enough. All right. We got 94 people. That's what my app says here, live with us right now. That's fantastic. All right, next one. Let's do this in red. I'm feeling red for this one because it's one of my favorite pieces of advice when it comes to a meniscus tear. Stop. So I'm going to just draw that right there. Quad exercises. Quad exercises are going to directly put more pressure in the knee joint. And here's how that works. So if this is your knee, here's a thigh bone, the quads are the muscles in the front of the thigh. If you do quad exercises, which are commonly recommended by healthcare professionals and on the internet, they'll say things like, oh, you have weak quads, that's why your meniscus tore, so therefore you need to get stronger quads. And no, you don't do that. Here's why. If your quads get stronger, this is the quad tendon, so all those thigh muscles in the front converge, they all come together and they attach to this tendon, which then attaches to your kneecap, and then that kneecap runs down and it has a ligament that goes down to the shin bone. And when your quads get stronger, it pulls this up, which you can see the meniscus right there. It just applies pressure to it. And here's the thing with strengthening. Y'all know this. If you don't exercise for a while, you get flabby, right? Your muscles just get all flabby. You lose tone. You're not toned anymore. Then you start to exercise and your muscles tone up. This is the basic term for it. What we call it in the fitness world is just you're getting more toned. In the healthcare, sciencey, physiological world, what I call this is we have an increased resting tension within the muscle. Muscles produce tension. They contract and they relax. If you work them out, then they practice contracting, and then they have an increased resting contracted state. We call this increased resting tension. That means, going back to your knee and the meniscus, getting stronger quads just does this a little bit. It just pulls. Let me see if we can get a good view on that. It just pulls the quad tendon up a little bit like that, and it increases the pressure on that meniscus a little amount. But the thing is, it happens constantly. While you've strengthened, you've just upped the strength in your quad. Now you have an increased resting tension. At rest, you could be lying in bed, you could be sitting down, you could be traveling in a vehicle, you could be having a meal or at work. And all that work you've put into your quads, all the time you spent strengthening your quads, now just increased the pressure through your poor meniscus tear. This is why you should not be doing quad exercises. It's only going to worsen the meniscus tear by putting more pressure on it. That's why I want you to offload it so you can take some pressure off of it. So stop doing quad exercises. I can't stress it enough. It is a huge problem that I see in people that are trying to recover from a meniscus tear. They're doing quad exercises, and they're usually following what their healthcare provider told them to do. But my best advice is give it a shot. And if you do quad exercises, and if it hurts right away, that's pretty good feedback that it's going to get worse if you get stronger in your quads. But sometimes there's a delay of about a week or two. You're working on quads, on a consistent basis, maybe daily. And then after a few days, maybe after a week or two, pain starts getting worse in your knee. It's because of what I just explained with the quads. So don't work out your quads. All right, let's do this color here. Quit hamstring exercises. I'll tell you what to exercise in a minute, in case you're like, well, those are all my exercises. I've been doing nothing but quads and hamstrings. I get that from people all the time. But here's why. Now, it's not pictured here. I don't have a good model for this, but on the back of the thigh, here's the front because there's the kneecap. On the back, you have the hamstrings. Front is the quads. The back is the hamstring muscles. Those hamstring muscles, the ones that bend your knee on the back of your thigh, they run down, they split, and they attach to the sides of the shin bone. They cross the knee joint, and they're in a position, because they cross the knee joint, to also add compression to the meniscus. So if you go do quad strengthening exercises like knee extensions, where you're straightening out your knee against resistance, everybody knows the machine in the gym, right? The knee extension machine, where you put the bar in front of your shins and you're just straightening out your knees. Leg extensions have a similar effect. But then there's also the leg curl machine, or the knee flexion machine, or the hamstring curl machine. They're all the same thing. There's different versions, but the idea is you're now going to bend your knee against resistance, but you're adding compression to the poor meniscus. So stop exercising your hamstrings. Don't exercise the quads. Don't exercise the hamstrings. Offload. Now, this is when you're flared up, when it hurts and you can't bear weight. Once you can put your normal body weight to your knee and your meniscus doesn't bother you, then you're about done offloading, at least for now. You might need to come back to it if it flares up. But these are a constant, like throughout all rehabilitation parts for meniscus tear. You don't want to do quad exercises or hamstring exercises. I wouldn't allow anybody to do it until they're like well into feeling fantastic. Like they've been running, they've been jumping, they've been going up and down stairs. And even then I would say, unless you're going to do a bodybuilding competition where you need to be judged in front of people in your bikini and you need to have massive quads and hamstrings, I wouldn't be strengthening your quads or hamstrings. If we're just talking about you want to be healthy and be able to be active, no reason to do it. Absolutely no reason to do it. All right, let's talk about the next point here. Number 4 is alignment. I'm just going to put knee alignment. When I'm talking about alignment, this is something that I talk about from here and there about a tibial shift. Let me explain this to you. I mentioned earlier that the knee joint has little bits of motion. Yeah, the big motion that everybody knows about is bending and straightening. Obviously, your knee can do that, but there's tiny bits of rotation and sideways movements, and your knee can possibly be shifted over this way. Make sure you can get a good look at that. So it has the ability to shift sideways right here. This is very specialist, if you will. Like it's something that I've been taught by my specialist mentors, and the only other people that I know that know about this stuff and talk about it are people that I've taught and who have been taught by my mentors. The idea of a tibial shift is not a well-documented, well-researched thing that is taught in schools, and every doctor and every physical therapist or any, this general knowledge in the medical field, it is not well known. And the experience that confirms it for me is when somebody has knee pain. It's bad. You can't walk, or you can, but it hurts a lot. Maybe there's some swelling. And sometimes it comes on with an accident. Sometimes it just happens spontaneously. But that person ends up going to the doctor, and they take x-rays, maybe an MRI. And then the radiology report after the imaging, the x-ray and the MRI, they say everything's normal. And it leaves the doctor and the patient baffled, because they're like, I know you hurt. And the patient's like, I'm hurting. Look, my knee's swell. I can't walk. I'm limping. But the x-ray and the MRI say everything's normal. So yeah, a little bit of swelling, but nothing's torn. Nothing's broken. Cartilage is there. Don't know what's going on. And then they kind of don't know what to do except put you on medications, maybe give you an injection at that point. They're just doing pain management treatments to hope you get over it. And then sometimes you just get over it. Like, it goes away within a day or the next day or maybe a week later. Sometimes it lingers for a long time. When I see those patients, I'm looking for a tibial shift. I'm looking for this to be happening or this to be happening. And I can't tell you the number of times that I found a big shift in somebody like I just described. Nothing on the x-ray, nothing on the MRI. I do my techniques and I show them the exercises they need to do to reset their tibial shift. And it's like magic. Maybe there's a pop, maybe not. I've got videos on this on YouTube. Our most popular video, how to fix inner knee pain in 2 minutes. It's about a tibial shift. And you look through the comments, people are just commenting saying, this worked. Oh my gosh, my knee pain went away. I've dealt with this. I've talked to the doctor. I've had the x-rays, normal. That's the normal situation. But what about if you have a meniscus tear, because you went to the doctor, you got the MRI, you have knee pain, hurts to walk on it. They find a tear on the MRI, and then immediately the tear is blamed. And we know there's research to show that you can have a painless meniscus tear. So it begs a question. This is where I have my specialist thinking on this. Is it really the meniscus tear that's the source of pain, or is it the shift, the tibial shift? I'll see these patients as well. We correct the shift, pain instantly goes away. I didn't fix a meniscus tear in an instant. We just realign the knee. So it comes back to knee alignment. So if you have a meniscus tear, look at your knee alignment. Chances are you probably have an issue there, and you can make a massive improvement. Now, sir, there's clients of mine, there's patients we have here, people that are following us on social media that have tried that fix and it didn't help, because that's not going to be the case every time that there is an alignment problem. But this does happen way more than we know, way more than we think. We just don't have research on this stuff. It's part of the way the joint moves that we don't know much about. So I hope that helps you guys out. All right, next one on here. Foot strength is critical for healing your knee, your meniscus. I'm just going to write strength like this. If you don't have good strength in your foot, and especially if you have a fallen arch, I don't have a foot model with me here. I'll just use my hand here. If any moderators are watching, if you can bring me a foot, it would be super helpful. A foot model. If you think of the foot, so here's the foot, and that's your arch. Toes are out here. If your arch falls down when you stand on it, like you put your weight and if you look down at your foot, you got to be in socks or barefoot. You can't be in shoes, because shoes will they'll help you with your arch support usually. Not all shoes, depends on which shoes you have. But if you stand barefoot on the ground and your arch starts to flatten out, that automatically moves your knee a certain way. It moves your knees inwards. It causes there to be bad pressures in your knee joints. And it can be the nagging pain that just doesn't go away. Because oftentimes people have like a sporting accident, or they have like a severe flare-up of their meniscus problem. And then they do stuff to kind of make it better. It calms down. Maybe they offloaded. Maybe they started doing the right exercises. But there's like 10, 20% of the problem that still is there and is nagging. And that can go on for months, years even, and it can be what sets up somebody for knee osteoarthritis later on. Very often it relates to the foot strength. And if we can fix that foot strength, then you have a shot at optimizing, at getting all the pressures right in the knee and setting yourself up for minimal to no alignment problems in the knee. But you have to pay attention to the foot. I went through my career as a physical therapist, working with, before I started this YouTube channel and all the stuff we've got going on now, working with other therapists who would get referrals from doctors, and the referral would say it was a paper from the doctor that said knee pain, help them with knee pain. Sometimes it said, meniscus tear or osteoarthritis or whatever it was. And then the therapist was like, doctor said to treat the knee, so that's all I'm going to treat. And I right away was like, what about the foot? What about the hip and the back? Like it's all connected. We need to pay attention to all that. And they're like, oh, I can't touch the foot. We have to just worry about the knee. So we're going to do knee exercises. And they were missing the boat. And I didn't feel like I needed to ask the doctor permission. I could see that their feet were weak. Their toes were weak. Their arches were collapsed. We needed to address that. And it made the world of a difference on a handful of my clients. And that might be you. If you're dealing with a meniscus tear and you're not paying attention to your foot strength, or if you're always in shoes and you never really give your feet a chance to work outside of shoes, you probably have weak feet. It's usually toe flexors. It's usually when you curl your toes all the way, that gets the arch muscles stronger. And then there's a whole bunch of exercises to do. I recommend checking out our playlist of videos on YouTube for meniscus tears. We got tons of stuff on there. Go on to the next one. All right, we got what you can do in the meantime. Yeah, arch supports are very helpful in the meantime because it's going to take you a little while to get stronger in your foot muscles. I recommend using arch supports, but not permanently. I wouldn't look at it as like I need to be in arch supports my whole life. And I don't think it's necessary to get very high-end arch supports. There's stores out there that specialize in selling arch supports. You can find, and when I'm talking about arch supports, there's different names for them. I have some in my shoes right now. These come with my shoes. I get people asking every now and then, what kind of shoes do you have? It's this one, Olukai. We have it linked in some of our videos because they're super comfortable. And they come with an insole like this. Arch support orthotic is another name. There might be another name that I'm forgetting, but they've got a little bit of a support right here. And I like that in these shoes because I tend to stand a lot in these shoes. I might be working all day in these shoes and I might be on my feet all day. And so a little bit of help is beneficial so that I can tolerate the full day without my muscles in my feet giving up my arch, and I still have some support. So if you're in a similar situation, it doesn't mean you need to be standing all day, but if you're standing for a good portion of the day or long enough that your feet get tired and you can't support your arches with your toes, then I recommend using the arch support. But long-term, because this is short-term, long-term, get your feet stronger so that you don't have to rely on the arch supports. All right, next one here. Abdominal strength. Making good headway. Getting your abs, abdominal strength, stronger is key for setting up your other muscles to work well, like the glutes. I'll tell you about the glutes here in a moment. But in your abdominals, oh, we got a skeleton here. That'll help. Abdominals run from the bottom of the rib cage here to the top of the pubis bones here, like the bones in the front right here, down low, and then around the edges right here. So if you think on your body, it's like my rib cage is right here. So from here down is abdominals, and then around the edges, all this area right here is abdominal muscles. And because it connects to your pelvis, this is your pelvis. These bones right here, along with the tailbone, all of them together as a unit is called the pelvis. Your abs have the ability to set the position of your pelvis. So when you strengthen your abs, what tends to happen if you strengthen them correctly is you do this. Your hips start to go forward a little bit as you get stronger and you have better control. Like right now, obviously you can see that I'm doing this motion. I'm kind of bringing my shoulders down. I'm moving my hips a little forward. When I do that, I straighten out my spine some instead of having it very curved. Because if you're doing this, if you're sticking out your bottom, then your abs are weak and they let go. When your abs are weak and your butt sticks out like that, then you lose control of your glutes. So it is foundational to have good strength in your abdominals to be able to support the knee from the top down. If we think of the foot as being able to support the knee from the ground up, from the foot up, you also need a similar stability from the top down. So you can't neglect the abs. This is the other 10 to 20% that some people are missing. I find consistently people have over-dominant quads, a lot of times over-dominant hamstrings, because they're exercising these muscles quite a bit, and they're ignoring the feet and ignoring the abdominals and the glutes, which I'll talk more about in a second. Glutes are the biggest one, but foot strength and abdominal strength are second and third, tied for second, if you will, in how well they can get that last little bit of extra support for the knee. Very underestimated, but you can have some huge returns and get somebody over the hump on like, oh, I can finally feel no pain. Like the pain got better. I'm doing a lot better now that I strengthened my glutes, but I still have some issues here and there. I still run into some walls with certain activities, limitations. I can't be on my feet that long. My knee starts to bother me. Then we look at foot strength and abdominal strength, and all of a sudden it's like, I don't have anything. I can run and walk and be on my feet as long as I want, do activities, chores, exercises, and I don't have any problems. And it's when we strengthen these two, foot and abdominals, foot muscles and abdominals. All right, what's next here? We got glute strength, my favorite. Talked about abdominal support. Glute strength. All right. When you get stronger in your glutes, so much good stuff happens. For the meniscus specifically, I've got the skeleton here, so you can kind of see it, but I'll pick it up. Glutes are right here, obviously, back of the hip, and they attach to the side of the femur. This isn't going to be, there we go. All right, here's the femur, here's the thigh bone. Glutes run from this area and they run outside of the femur. Because of their attachment right there, they have the ability to move the leg backwards this way. If you look at it from the side view, it's moving your leg back to push your body forward because your foot makes contact with the ground. See why the foot's important. And then it also has the ability to rotate your hip joint. And when your glutes are strong, it rotates your hip joint out a little bit. That resting tension idea that I talked about, you want good resting tension in your glutes because it positions your hip properly, helps with hip problems, but then it also positions the knee properly. If you turn your knee outwards like that slightly because you have good glute strength, then the forces going through your meniscus are going to be optimized. So you're putting good, normal forces that your meniscus is designed to take. Because remember, they're cup-shaped and the thigh bone's more round, so it fits onto it. But if you overload it, that's when you start to get a tear, when you start to get injuries to the meniscus. But when you fix the rotation, now you're correcting for alignment issues. You're distributing the forces more evenly. You're just using your knee the way it was designed to be used when you have proper glute strength. Doing this, avoiding quads and hamstrings, getting good foot strength and abdominal strength, and definitely making an effort to fix your glute strength to get really strong in glutes allows you to fix the imbalance, the muscle imbalance. This is what I call an imbalance. This is also something that's like kind of quasi in the medical field. Like you hear people mention imbalances sometimes, but they don't really define it. They don't really tell you mechanically what it means. They'll just say, yeah, this is probably, oh, your MRI was normal, your x-ray was normal, your knee still hurts, must be an imbalance. And they just kind of leave it at that. Want some pain medication? Here's an injection if you want. Like that's the end of normal general medical knowledge. The way that I talk about it, I'm telling you, your quads and your hamstrings are over dominant. They're being used too much, probably because you might have exercised them too much. They're compressing the joint because of their attachment sites. They add compression to the joint. And if you stop exercising them, then you start to take pressure off. This is all long-term. Short-term would be offloading, arch supports. Short-term is the knee alignment. But then if you fix the foot strength, you better align the knee from the bottom up. You fix the glute strength up top, and you better align the knee from the top down. And then you get good abdominal strength above the glutes, and you position the glutes to work as best as possible. That is fixing the imbalance. That's putting the right pressures through your joint so that the pressures can be balanced and not over compressed. So imbalance is key. Long-term play, though. It's going to take you some time to strengthen and get the right things in place. All right, making good progress here, and then we'll answer some questions before we're done. Number 10 thing that I got for you is you got to be patient. Don't rush pain. What did I write? I want to get it right. Don't push pain. Don't push through pain. Because the meniscus is cartilage. Cartilage is the slowest healing tissue in the body. It can heal. It is metabolic, meaning like it's alive. It has cells that are alive, but its metabolic activity, the rate at which as processes happen within those cells is very, very low, which means that healing happens at a super slow rate. And so if you're pushing through pain, you're irritating it. And because of the slow healing process, you're just delaying and potentially worsening the problem, making the tear worse, because the meniscus itself never gets a chance to get strong again from healing because you irritated it if you weren't patient and you pushed through some pain. So you absolutely cannot push through pain. And I have even seen people guided by medical professionals because they're on a time crunch with insurance reimbursement. You know, they're like, we have this many visits and we only have this time to use it. So you need to be progressing to running before we're done. And that poor patient is dealing with pain. Like you can't use that as a limiting factor. You have to just be guided by your knee and don't do more than what your meniscus can take. As it's healing, it's building its tolerance to take loads. And ideally, you know, at first you build the loads to just walk, then you build the loads to like go up and down stairs. If you keep healing, you can eventually add weight to your body while you're exercising, very controlled, and then take more weight, and then eventually maybe even like jumping type activities. It's very possible for somebody with a meniscus tear to train into plyometric or jumping type activities, but you have to gradually work your way there. You can't just jump into it abruptly. And cartilage just heals in the time frame of months, not weeks, definitely not days. It's more on the time frame of months. And if you're constantly doing something to irritate it, like you just overdo it with walking or you start to jog and you hurt it, it's like picking at a scab. You know, scabs, a skin injury heals at a much faster rate than cartilage. You can be done with a cut in a week or two. But if you pick at that scab, then you're going to reopen it, you'll bleed again, and you have to go through the entire healing process in that area that you reopened, which is going to delay you another week or two. And if you keep doing that over and over again, it could be months with that same cut. But if you would just cover it, baby it, you know, make sure you're not re-injuring it, you'd be over with it much faster. And it's the same thing with meniscus tears. It just happens on the time frame of months, not days or weeks. So be patient. Take some time. I got a few bonuses for you guys. Number 11, don't prioritize stretching. Stretching is so overdone because it's seen as like a really easy thing to do. You know, just touch your toes, stretch, pull your heel of your butt and stretch out your quads. And I'm not saying don't do stretching. Like, get me right. I put the word prioritize in there on purpose. I was very strategic in saying that. I'm okay if you stretch. If I ever see somebody that I work with stretching, I don't tell them anything. I'm just like, cool, that's fine, go for it. Where it's a problem is if you tell yourself, I'm going to stretch every day for 30 minutes, 60 minutes, or I'm going to stretch once in the morning, once at noon, once in the evening, and put myself on a stretching regimen, you're not going to fix the problem. In fact, it tends to get worse over time when you do that. I'm okay if you wake up in the morning, you just, move around, take a few seconds to bend your knee, stretch, do the morning stretch routine. That's fine. You see animals doing that, but you don't see an animal stretching for 30 minutes. It's not what we're supposed to do. The reason you feel stiff is because of the muscle imbalance. You've got over-dominant quads and hamstrings, and so it's making your poor knee joint stiff because it's compressed, and so you feel the need to stretch it out, and you do get some benefit right away when you do it. You could probably feel looser in your knee. However, you don't fix the imbalance because you're prioritizing stretching. You're just going to feel stiff again in a moment, in an hour or two later, definitely by the end of the day. So stretch if you want, but don't focus on it. Not a big deal. All right, next up we have Medications and injections. Big one. Don't rely on them. Don't rely on, sorry, I'm getting messier here. I'm just gonna write meds and injections, INJ. Again, I'm not saying don't take them. It might be right for you. You have to determine that. I can't tell you that, yeah, for sure it's right for you or for sure it's not right for you. Where it's a problem, though, universally, is if you live your life with a known meniscus tear or any other injury, and you say, I have ibuprofen here, and I'm just going to pop them round the clock, as the bottle says, endlessly, you're going to have side effects eventually. Some people get them right away. They start getting stomach issues. Some people, it takes weeks to develop, but then they can have like an ulcer, which is a hole in your stomach, and you can get internal bleeding. You could get more long-term side effects, kidney damage, brain damage, other issues, your liver, of course, will get damaged. But it is not a good idea to rely on pain medications and injections. If you find yourself in that situation, what it means is that you're not facing the long-term problem that you need to fix. You got to go fix the imbalance, get stronger glutes and abdominals and feet, and you have to stop strengthening your quads and your hamstrings. You need to start offloading. A lot of people, they just start this, you can immediately stop injections and medications. Can't be relying on them. They're not a good long-term plan. Might be okay in the short term. Your doctor might push you on it because they're doctors of medicine. That's what they know. So they're going to recommend it right away, but they're not experts in the imbalances. That's what I do. Thanks for being here watching this, by the way. All right. 13. You need to relearn walking is the last one. Relearn walking and stairs. I know I misspelled. I didn't write walking, but you get it. Once you get your strength, once you figure out how to get the imbalance going, it's not just about gaining the strength, being able to produce more force or last for longer, holding those muscles, holding your feet and your abs. You need to learn how to coordinate it in your everyday movements. A good example that I like to give my patients is, if you like music, for instance, if you think of a band, think of your favorite band. There may be like a drummer, a guitarist, a bassist, a singer. We'll just say there's those 4 people. If the drums are very loud and you can't hear the guitarist, the bassist, or the singer, it's going to sound terrible, right? You're just going to hear a bunch of drums. And it's the same thing for any other instrument. If you just hear a lot of vocals, a lot of singing, but hardly anything from the other instruments, or you just hear a lot of bass and nothing else, like it just doesn't sound. You need to have the right balance of each of the different instruments, each of the different sounds, so that you can play a beautiful song. Same is true when you're walking. When you walk, you need your abs, your glutes, your feet. You do need some quads and hamstrings to work, but you need them all to work in the right amounts, in the right volumes, at the right timing, just like instruments play notes at certain times in certain volumes to produce a beautiful song. It's the same thing with your muscles. You have a bunch of instruments, a bunch of muscles helping you to walk, helping you to go up and down stairs, and you need to learn when to play each instrument. And it may require you getting over the fact that you need to relearn how to walk, even though you've been walking for 45 years. And you thought, I've walked up and down, this street and that street, and I've run miles, I've run marathons, and I've never had to think about how I do it. I get this comment from people sometimes, and they're shocked that I'm like, all right, we're going to take a step, pause, lean your weight onto that leg. Now think about what your glutes are doing. Now think about what your feet are doing. Then take the next step, and you feel like a baby. And that's what you have to do. It's the basics. If you think of pros, this is another analogy to think this through, just to drive the point home. If you think of professional athletes, baseball, soccer, football, any professional sport out there, even at the highest level, at the beginning of the season, they're going over the basics. In baseball, they're practicing catching, throwing, batting, running the bases. In football, they're practicing agility drills. They're practicing hitting and tackling. They're not getting all the fancy plays, all the the ESPN top 10 things that you see. That's later in the season after they've warmed up and they know how to do that better. At the very beginning, they're doing the basics. And truthfully, it's the basics that probably win the games 80, 90, 95% of the time. And then you have that one trick player, that one crazy fluke play that was partially luck that made the headlines. It's the same with walking. You might have that one odd step or that one time of the day that you have to do this weird thing with your body to get in and out of the car or to, maneuver yourself into a certain chair. But most of the time, you need to walk straight and have some gentle turns. So if you can practice the walking and stair climbing and master that, you're going to be good. Your meniscus is going to love you. You're going to heal. And most importantly, you're going to avoid surgery, avoid knee arthritis, and avoid a knee replacement later on in life. All right, guys. Thanks for hanging in with me. Let's answer some questions. Oh, we got a new member on our channel here. Aldalucia Zerio. I'm so sorry if I mispronounced your name. Thank you for joining our membership here on YouTube. I appreciate it. Let's see what questions we have here. I'm going to go back up. If you have a question, if you're on YouTube, you can do a super chat and jump in to the top of the questions here. I got like a little under 10 minutes to answer some questions. So my spirit, soul, and body says I had a knee operation on July 25th this year. And 3 days later, I came across your channel. I had a total meniscus tear, Vanessa. Oh, I'm so sorry. And sometimes it's necessary to have the meniscus operation. I think a lot of times it's not. I hope your situation was an absolutely necessary situation. Either way, whether you needed it or not, you still need to make sure you fix that imbalance and get your right muscle stronger and don't work out these. And I want to caution you, if you're going through physical therapy right now for your rehab after the meniscus tear, it's going to take you some time. And they may have you doing a lot of this, quads and hamstrings. And where I say it's okay is if your hamstrings are shut down. If your quads are shut down, like you can't really activate the muscle. If you look down at your quads on the front of your thigh and you're like, I can't get it to work, then it would be okay to focus on quads. But this is only in a situation where it's after surgery, after some injury, which surgery is a controlled injury. If you think about it, they're cutting through you, it's injuring you, but with the hope of a better situation after you heal, because it's surgical, it's precision, versus an accident, where something bad, traumatic happens. So you do want to make sure the activation comes back. But once your quads are active just fine, once your hamstrings are activating just fine, it's time to stop focusing on that and go to foot strength, abdominal strength, and glute strength. Fix that imbalance, learn how to walk and use stairs properly. And most importantly, after surgery, Vanessa, you have to be patient. It's going to take you months, 6 months. Whatever the surgeon said, you usually have to double or triple it. I'll put it to you that way. All right, Shibra Gaur. I'm so sorry if I'm mispronouncing names today. Hello, Dr. David. Joined from India. India's here. So cool. Osteoarthritis, got gel and plasma injection. It is better now. What can I do to keep it healthy? Cool. I'm glad you got the gel and the plasma injection. So for everybody listening, he probably got a hyaluronic acid gel injection, and then plasma is usually a platelet-rich plasma, PRP injection. And these are like regenerative medicine ideas from, they're not pain medications. They're trying to heal the inside of the joint. So it's typically used for osteoarthritis. You got to fix the imbalance, because what got you here is probably over-dominant quads and hamstrings and a lack of glute strength and abdominals and feet. And if you don't fix it, you're going to end up in the same situation. And a lot of doctors and in the media, whenever they talk about gel injections and PRP injections, the platelet injections, that's kind of like the cutting edge general medical research out there, because it's it's a new type of injection. So it's the sexy thing to look into. And if you're a doctor, doctors like to do it, by the way, because they don't bill insurance. Insurances don't usually cover that stuff, at least in the United States. And so they'll offer gel injections and PRP injections as a service that's what they call cash. Like it's the patient's going to pay for it directly, and they don't have to deal with the insurance company. So it's more lucrative for them. And it makes sense. I would offer it too. Plus, it's not corticosteroids, which are known to have problems with damaging your cartilage. So I like it. I think it's a better idea. However, it's still short term, because if you still have that imbalance, quads and hamstrings are too active, even if you do generate new cartilage, or you heal the cartilage you have, or you put some space in the joint with the gel, you're going to squash it as soon as you work your quads or your hamstrings. Or maybe you're not even actively working your quads or hamstrings, but you have the imbalance, and every time you go walk and you're active because your knee might be feeling better, You're training the quads and hamstrings because they're dominant because you might not have good glute strength. So you have to go back and make sure that you're using your glutes when you walk and you have good glute strength to do all the activities you have to do. I hope that helps. I certainly hope your knee pain goes away. I wish you the very best in your knee. SS Fault says, hi, I'm an athlete that is 97% sure I have pes-anserine bursitis. My season starts this Thursday. What should I do? I'm so sorry. Yeah, pes-anserine bursitis. For those of you guys that don't know what this means, it's a bursitis, meaning there's a fluid-filled sac that's irritated and painful and swollen. And it's on the inside of the knee, kind of lower on the knee, kind of upper shin on the inside part. There's a bunch of tendons that come in from the thigh, from the groin muscles that attach right below the knee. And because they're all bundled together there's a bursa to kind of reduce the friction in the area. That's the whole point of a bursa, is just to help things move better in the area. If you get bursitis, swelling of the bursa, then that means that you're using those muscles too much, or you're putting too much pressure somehow in the area. And usually if you have that collapsed foot arch, your knee will move inwards. Let me show you on the skeleton. Better. It's a good thing I lift weights. This thing doesn't feel too heavy for me. All right, so here's looking at this leg right here. The bursa is right here for pes-anserine bursitis. You have groin muscles that start here in this area, and then they come down the inner thigh, past the knee joint, and attach right here. And so if your arch on your foot collapses down, then what it's going to do, if you see the arch right there, it's going to tip the foot inwards, which tips the shin bone inwards, which if your leg is straight, oh, it's caught right here. There we go. If your leg is straight because you're standing on it and everything tips inwards, it's going to tension the inside part of the knee. And that adds tension and pressure to the bursa there, the pes-anserine bursa. So we got to look at your glute strength too, because your glutes, remember, help rotate your leg outwards. It helps to control that same motion at the knee. It's usually glutes and feet that need to improve, very likely abs as well, in order to take pressure off the pes-anserine bursa. If you'll notice, a lot of knee problems, I keep coming back to glutes, feet, and abs, and I probably sound like a broken record, and it's because it's the same muscle imbalance. If glutes, feet, and abs are weak, immediately these muscles like to take over. Quads and hamstrings, and there's some hip muscles, hip flexors, they like to take over too. And they just, your body figures out, I have to do this movement. I have to go play the sport. I'm an athlete. I have to run and kick this ball or throw this thing or whatever you're doing with your body. And it just figures out a way to do it and isn't thinking about, oh, I should use my glutes when I do that. I should have better feet activation when I do that, foot activation. It just does it. But you have to remain in control over how your body's moving, which muscles are activating, so that you can keep the pressures just right all over your body. I hope that helps there. I'm not even going to pronounce your name. So sorry. All right, we got time for one more. Judith Cochran says, hi, Dr. David, patella issues in Central California. Fantastic. So sorry about your patella. So the two biggest ones when it comes to patella issues is going to be patellar chondromalacia patella, and then, oh my gosh, the name slipped in my mind. Patellofemoral pain syndrome, PFPS. They're basically the same thing, except with chondromalacia patella, there is visible damage to the cartilage on the back of the kneecap, right there. So the patella is a kneecap, just to make that clear. And when there's patellofemoral pain syndrome, quads are too overactive because glutes are usually weak, feet and abs are weak too. And so when the quads get overused, they get an increased resting tension, and that just does this. It pulls on the quad tendon, and at the kneecap, it pulls the kneecap slightly more against the thigh bone. And when you go to bend your knee, it's really smashing it on there more than the tolerance on that what the cartilage in the back of the kneecap is able to take. As a result, it becomes irritated, and if this happens long enough, then you start to damage the cartilage. That's the root problem explained really quickly. What you got to do is get those glutes stronger, get your feet stronger, abdominals. Those are the big three. You fix those three, learn how to walk, learn how to use stairs, and pain goes away tremendously and for the long term. And then if you learn how to run, because you could probably get back to running if that's something that you're doing. If you're an athlete like the person before, you probably get back to your sport. You just have to learn how to become glute dominant rather than quad and hamstring dominant. All right, guys, I'm at my time. Heard my timer buzz. I have to go to another meeting here. So it was a pleasure doing this with you guys. I love doing this. This is so much fun. I wish I could see you guys and talk to you guys in person. Like we have a couple of group coaching calls that we do every Thursday, and we get to do that with them. Check it out if you're interested. The knee arthritis recovery program, hip arthritis recovery program. That's where we do the live calls over Zoom. But this is pretty cool too. I'll see you guys next Tuesday. Bye-bye.